In this presentation, I will be discussing the treatment of post-traumatic stress disorder using CAM therapy. Although PTSD can occur in any population, the focus of this presentation specifically discusses PTSD affecting military men and women. PTSD stands for post-traumatic stress disorder. It's an anxiety disorder that can occur after a traumatic event. The event could be something that happened to an individual, or someone could have witnessed a terrible thing happening to another person or group. After the event, many people feel afraid and nervous. Anyone who has gone through something like this can develop PTSD. A particularly vulnerable population is men and women in the military, especially those who have had combat exposure. Symptoms of PTSD are often organized into 3 categories or clusters: reliving the event, avoiding reminders, and being on guard. Reliving the event may occur through recurring nightmares or other intrusive images that may come to mind at any time. People who suffer from PTSD may also experience extreme emotional or physical reactions such as chills, heart palpitations, or panic when faced with reminders of the event. Avoiding reminders of the event include people, places, thoughts, or other activities associated with the trauma. PTSD sufferers may feel emotionally detached. Many will withdraw from friends and family and lose interest in everyday activities. Being on guard, also referred to as hyperarousal, includes feeling irritable or having sudden outbursts of anger, often for no apparent reason, and having difficulty sleeping or concentrating, or being overly alert or easily startled. It's not surprising to learn these symptoms can wreak havoc on one's life, even making daily activities a challenge. In the next slide, we will listen as 2 veterans share some of their internal struggles after coming home.
When you're in the military, you're asked to do things that in everyday life are considered wrong. The person I had to be to do my job was a horrible person. In my eyes, it was a horrible person, and I was good at it.
When I first returned, I did have a lot of trouble sleeping. I did have a lot of nightmares and dreams.
I take Ambien to get to sleep every night.
I would relive the experience of running up to someone who's dying or watching someone get shot.
The veterans you just watched were not actors. They are real people who suffer from PTSD. Later in the presentation, you will learn what treatment they are using that has helped them. But first, let me introduce Thomas, the veteran featured in this hypothetical case study. Thomas is a 26-year-old white male. In high school, he did very well. He made good grades, had lots of friends, and after graduation even received an academic scholarship to the university he planned on attending. Thomas had no trouble adjusting to college. He lived in the dorms, made lots of new friends, and was involved in several extracurricular activities on campus. Sophomore year, he finally had the courage to ask out Amy, a cheerleader he had a crush on for over a year. She said yes, and soon the two became inseparable. Thomas and Amy had been dating exclusively for about 6 months when they learned Amy was pregnant. Thomas wanted to continue his education, but knew he had to prepare financially for a new baby. Thomas had considered joining the military after high school, but when he was offered a full-ride scholarship, he decided against it. He decided to join the National Guard and hoped that he wouldn't have to deploy. Thomas and Amy soon married, and shortly thereafter their son was born. The new baby was just 4 months old when a letter arrived in the mail. In it were the details of Thomas's upcoming 18-month deployment to Iraq. While in Iraq, Thomas worked as a truck driver. He was stationed in an area that was dangerous. Several times a week, they would hear explosions not far away. One day, while driving with several soldiers from his squad, a roadside bomb exploded. Listen as Thomas describes in his own words the terror and fear from that day.
Mike and I were laughing about his upcoming 21st birthday and how we were going to celebrate. And then, without warning, everything changed. I'll never forget the intensity of that explosion. Debris flying everywhere, it became so dark. I could hear Mike screaming, and when I was able to look at him, I knew it wasn't good. He was covered in blood. Blood was everywhere. I just froze. I knew I needed to get these guys help, but the truck was not drivable. I was so scared to get out, and yet I was terrified to stay in. One of the guys from the back told me I had to do something, that his leg had been severed, and our friend next to him was unrecognizable and had been killed instantly. Mike hung on for about 10 minutes. He told me to tell his mom, dad, and sister how much he loved them. I remember begging him to just hang on. Help was going to be there. I kept trying to get him to stay awake. I was squeezing his hand so tight. 2 of my buddies died that day. The other has had about 15 surgeries, and they finally amputated one of his legs. I know people think that I'm the lucky one, but honestly, I wish I had died alongside them. The guilt, the overwhelming vivid memories, and the sadness, it is more than I can handle. What if I had left a few minutes earlier, or later? Would my friend still be here? When I got back, I knew life was never going to be the same. You don't go through something like that and then just expect to pick up where you left off. I started pushing people away. I am still so angry. I haven't gone back to school, and the few jobs I have applied for, they want to pay me minimum wage. I had it all, a full-ride scholarship. I was going to make it big. And now some punk-ass kid at McDonald's is offering me $8 an hour. I've also started drinking, a lot. When I drink, it's the only escape I have. And then I pass out. But when I wake up, it's back to reality again. Last week, Amy told me that she is taking our son and moving out. I've been taking the medicine that the VA psych doc gave me, and the side effects are horrible. I get dizzy, feel tired all the time, and have no sex drive. I am also seeing the therapist, but nothing is getting better. I can't tell you how much I hate myself and what I have become.
Thomas feels alone, but he's not. Many veterans from the Afghanistan War, also known as Operation Enduring Freedom, and the Iraq War, also known as Operation Iraqi Freedom, suffer from pronounced PTSD symptoms that contribute to alarming suicide rates. It's not unusual for traditional treatments such as medication and therapy to produce subpar results. Many veterans also feel a stigma associated with seeking traditional mental health services. Before we discuss treatment options for Thomas, let's take a closer look at his symptoms and what we know from the literature. As a VA employee myself, I'm very familiar with this 4-question survey. This very simple but highly effective screening tool allows practitioners to ask questions that would likely trigger positive responses in a patient with PTSD. In your life, have you ever had any experience that was so frightening, horrible, or upsetting that in the past month you have had nightmares about it or thought about it when you did not want to, tried hard not to think about it, or went out of your way to avoid situations that reminded you of it, were constantly on guard, watchful, or easily startled, felt numb or detached from others, activities, or your surroundings? Combat exposure is a risk factor for a number of psychological conditions, including alcohol misuse. There is considerable evidence for the link between PTSD and alcohol misuse among military veterans. Hypothesized explanations for the relationship vary widely and include the use of alcohol to reduce symptom distress, genetic and environmental vulnerability that increases the likelihood of developing both PTSD and alcohol use problems following a traumatic event, And finally, evidence has cited alcohol's role in the increase of endorphin levels as a possible reason for the comorbidity between PTSD and alcohol use. Understanding the complexity and severity is crucial in determining the CAM treatment therapy I wish to prescribe. I would like for Thomas to attend a 7-day workshop that is a mind-body resilience-building program for returning veterans. The facilitators teach practical, breath-based tools that decrease the stress, anxiety, and sleep problems that plague veterans with PTSD. A foundation of the Power Breath Workshop is Sky Practice, which stands for Sadhosharan Kriya Yoga. The workshop format includes a 20-plus hour program with practical take-home tools and ongoing support. The course session includes the Power Breath Meditation Workshop that is taught over 5 to 7 consecutive days in 3 to 4 hour sessions. Attendance at all sessions is required. Take-home tools. Learn a set of daily breathing practices that take about 25 minutes to complete. Some of the practices can be used as needed, day or night, to reduce sudden anxiety or insomnia. Ongoing support. When possible, participants are also supported through facilitated follow-ups with their trainers, arranged either in person when possible or via teleconference. According to leading researcher Emma Sapala, breathing-based meditation practices may be particularly beneficial for PTSD, given that it is a stress disorder characterized by hyperarousal, autonomic dysfunction, negative affect, and difficulties with emotion regulation. In the next slide, we will explore the connection between breath and emotion.
Many of us are familiar with the effects of stress on our body, from headaches to upset stomachs, body aches, and tiredness. But what about the effects of stress on one of our most precious assets, our brain? How about a crash course in what happens to the brain under stress and how we can handle it? Under stress, a physical response is triggered, which directly affects the brain in ways that impede our ability to focus and concentrate. This response limits our ability to connect with friends and colleagues and strains our relationships. You might remember from high school biology that brain cells use chemicals called neurotransmitters to communicate. Under stress, a hormone called cortisol is released, which hinders the functioning of neurotransmitters, making it harder for brain cells to talk to each other. This makes it difficult to think clearly and is the reason why we get confused in a crisis or a stressful situation. Cortisol also causes a chemical reaction that directly kills brain cells. In addition, cortisol triggers the fight or flight response. This directs blood glucose or energy away from the brain to our muscles so we can fight or flee. This can save our lives if we're running from danger, but in daily life, when stressed, the response creates an energy crisis in the brain, which obstructs our ability to learn new things. Fortunately, these effects can be reversed when stress is reduced. Knowing how stress affects the brain, one would think the solution is to simply force the mind to relax. Unfortunately, the mind has a terrible time telling itself what to do. For example, telling your mind to sleep usually leads to little or no sleep at all. Research at Harvard University found that forcing our minds to do something like relaxing just doesn't work. A solution to effectively managing stress and calming the mind can be found in a more tangible tool, breathing. Because there's a direct link between breathing and emotions. European researchers studied people watching movies that induced emotions of anger, sadness, and happiness. They discovered that each emotion creates a distinct breathing pattern. They also found that just having people breathe in these patterns induced the same emotions. This demonstrates that we can influence our emotions through our breath. So instead of simply being overwhelmed by our emotions, we can transform them through specific breathing techniques. Numerous independent studies have shown that the Sudarshan Kriya breathing techniques, or SKY, are effective stress management tools. Psychiatrists at India's National Institute of Mental Health found that levels of the stress hormone cortisol are significantly lower in SKY practitioners. Published research from Sweden shows that SKY significantly reduces the stress, anxiety, and depression we face under the demands of everyday living, and increases our optimism and well-being. It's as effective as standard antidepressive drug therapy, is free of side effects, and has less drain on the wallet. SKY can also increase our ability to excel. It has been found to enhance brain functioning. Published research shows that SKY significantly increases beta brainwave activity, which is associated with heightened alertness and increased focus. Independent research worldwide indicate that SKY is a potent breathing program that significantly reduces stress and enhances brain function. This can improve our ability to focus, solve problems, and understand complex issues. In addition to the physical benefits like lowering cholesterol and boosting immune function, regular practice of SKY relieves anxiety and enhances well-being and positive emotions. In fact, prolactin, a well-being hormone, is shown to significantly increase from the very first session of SKY practice. And it is well known that emotional well-being is directly related to productivity, concentration, learning ability, and success. The benefits of practicing SKY for any business, organization, or family are obvious, and results grow over time. In a world where everyone is under increasing pressure, regular practice of SKY creates a powerful advantage for our mind, body, and how we interact with everyone around us.
Research shows that SKY practice helps to relieve symptoms of PTSD. The University of Wisconsin-Madison has recently completed a study with Afghanistan and Iraq veterans who participated in the Power of Breath workshop. The results suggest that this workshop significantly reduces symptoms such as anxiety, anger, sleep problems, and that the benefits persist over time. In addition, research shows that these programs are effective, safe, and free of known side effects. Another advantage is that the workshops can be scaled up to serve large numbers of veterans at a lower cost than many traditional interventions. Breathing-based meditation practices may be particularly beneficial for PTSD, given that it is a stress disorder characterized by hyperarousal, autonomic dysfunction, negative affect, and difficulties with emotion regulation. Recall this slide from earlier. It describes the different clusters of PTSD symptoms. It is the symptom group that research regarding SKY has shown significant improvement with. This information is promising because it is a cluster of symptoms that is often the most resistant to traditional treatment interventions.
About 20 to 30% of the over 2 million veterans that are returning from Iraq and Afghanistan are thought to suffer from PTSD. In the presence of PTSD, the brain structure is changed. Some of the side effects are anxiety, depression, rage, which often comes out on close others, and finally violence and suicide. It's said that there are 7 veteran suicides a day happening in the U.S. at the moment.
We are interested in the examination of methods that may be non-pharmacological methods that may be helpful in calming your autonomic nervous system.
Breath in. There's nothing wrong with anybody in this room as human beings. Nothing wrong at all. It's just the mechanism for dealing with emotion got crunched, got overwhelmed.
And you know, the scents, the smells, the images, the sounds, some of those pictures I'll never forget. Running up down the middle of the road and seeing someone laying there fighting for his life. In the back of your head, you have the thought that there's nothing that you can do to help him. But, you know, you try anyway.
I think one of the biggest reasons I don't like to talk about that stuff is because I don't like what I did. Yeah, usually I have to take a full Ambien every night just to get to bed. Yeah, this week I've taken one.
And had no idea how breathing directs our mind to the present. So that's powerful.
I really appreciate that I had the opportunity to do this.
There are many ways to be a warrior. The more peaceful you are, the more you radiate that around. And that's also a way of being a warrior. That's also a way of keeping the peace.
You know, live, guys. Just live. Take life and embrace it. Give yourself permission to smile again.
As with any effective program, establishing appropriate outcomes and methods for evaluation should be established. With this therapy, utilizing surveys to obtain immediate feedback from the participants is essential. Written or verbal testimonials can provide powerful information about how the program made a difference in their life. Finally, follow-up phone calls or video conferencing will offer an opportunity for questions, to understand the level of engagement or compliance, and to provide general information about how often the patient is using the new skills they learned. No therapy offers a one-size-fits-all solution. SKY is no exception. For example, socioeconomical factors may prevent veterans from traveling to a workshop or taking time off work to attend. Negative stereotypes, such as men aren't supposed to do yoga, or I'm too tough to share this pain, are definite roadblocks we must work to remove. More research and larger studies need to occur to offer validation and establish evidence-based practice guidelines. We need more SKY instructors so that additional workshops can be offered at locations all across the United States. Each veteran is unique, and it is our job as healthcare providers to provide ways around these roadblocks so that we can optimize the treatment for veterans suffering from PTSD. PTSD has detrimental impacts on the lives of our returning veterans. Current interventions are not always successful. There is an urgent need to explore and expand available treatments. These soldiers are suffering. Every day, lives are lost from suicide. As healthcare professionals, we need to identify when current therapy is not working and use evidence-based practice and medical literature to find alternative treatment options. Each veteran has a unique set of social, psychological, and psychiatric issues and problems. The most important thing we can do is listen, validate, and comfort them. Many veterans are suffering privately and are ready to give up. Help them open those locked doors and discover CAM therapy treatment options. Thank you for watching this presentation. If you have time, I would encourage you to click on the YouTube link in this slide and watch a moving music video about PTSD.